गोव्यान सगळ्यात चड जर केसीस आसा इफ यू टेक द एवरेज तर ते मोर्मुगांव तालुक्यान आसा. ओके, गोव्यान चड अशें आसा अँड दीस ट्रेंड हे ऑलमोस्ट कितलींशीं वर्स चालूच आसा. ओके, सो चड ताचो एक कारण आसूं शकता की गोव्यान स्लम एरिया चड, मोर्मुगांव तालुक्यान स्लम एरिया चड आसा, जशें की बायना एरिया, निवाडे एरिया, जुवारी नगर. दे आर ओवर क्रावडेड, द पॉप्युलेशन खूप आसा, कळ्ळें न्ही. सो तो एक रिजन आसूंक शकता. पण चडांत जर नंबर जर पळयात तर टीबी केसीस चड आमच्या मोर्मुगांव तालुक्यान आसा.
हाऊ मेनी केसीस अशें कितें
फूल जर 2018चो जर फिगर घेतला जाल्यार पूर्ण गोव्यान अरावंड 2000 and some 6 ऑड केसीस आसा. तेच्या भितरले जर वास्कोनूच पळयता सो इट कॅन से अप टू सप्टेंबर 21 केसीस आर ओनली डायग्नोज फ्रॉम वास्को.
And what we have noticed is the number of tuberculosis cases is on the rise, and much more alarming is the number of drug-resistant tuberculosis cases. So if you analyze exactly what is the reasons for this multiple drug-resistant cases, there are n number of reasons. But what we are commonly seeing is these patients are also having a side by alcohol addiction. These patients mostly are coming from the slum areas which are overcrowded. There is malnutrition among these patients, and also there is alcohol addiction in the patient. So whenever we diagnose these cases, we start them on treatment. These patients, after a few weeks or a month or so, because of the alcohol addiction, they do not take the tablets, and these are the patients which will be prone and definitely develop drug-resistant cases. And we know whatever our treatment is there for 6 months is subsequently converted into 18 months, and sometimes for drug-resistant cases, more and more second-line drugs, sometimes very costly drugs have to be used. So in all, my advice is for all the patients of tuberculosis, if they are having some coexistent conditions like addiction, coexisting conditions like diabetes mellitus, malnutrition, all this also has to be addressed. And while doing this address, the role of all our general physicians in the state of Goa is very important. We have to notify the illness to the TB centers. We have to give adequate diagnosis. We have to give adequate treatment and keep the patient under a continuous surveillance till the ultimate goal of cure and success has reached.